Yes, we are going to continue from where we stopped in the last module of family planning. We are talking about the pill. The last module we talk about the positive benefits of birth control pills. Positive benefits of birth control pill. So this module we are going to talk about the side effects. The side effects of birth control pill. It's going to be the continuity. We're going to continue from where we stopped the last module. I still remain Dr. David Olusegun Awoleye. Let's look at the side effects of birth control pills. Number one, breast tenderness. Breast tenderness. There's going to be tenderness, kind of pain when you press the breast of those that use the pills. That's one of the side effects. Number two is nausea. That is feeling like vomiting. The individual might feel like if the individual want to vomit. Another thing is increase in headache. There may be headache. These are the side effects of the pills. The moodiness. Person might be moody, and then weight change. The weight might change, especially increase in weight. Let's look at taking the pills once a day at the same time every day. So the pill needs to be taken once a day, and you take it at the same time every day. That means if you use it 8 a.m. today, use it 8 a.m. tomorrow, and so on and so forth. The first month you use the pills, you are advised to use condom for the first month. Use condom to back it up as a supportive contraceptive when you start using the pill, at least the first month. Use condom when on antibiotics. So when you use antibiotics, you are using the pills and you are on antibiotic for reasons, then you are advised to use condom for that period. Use condom for 1 week if you miss a pill or take one late. So if you take it late or you miss a pill, then you are advised to use condom at least for 1 week. Not only that, the pill offers no protection from STD. There is no protection for sexually transmitted disease. That means that once you know you are exposed, as in once you know that you need to be protected from sexually transmitted diseases, including HIV, you must make sure that you use condom, not the pill, because the pill has no protection against sexually transmitted disease. Now, let's look at Depo-Provera. Depo-Provera is the example of the injection. The example of the injectable. Don't forget, we mentioned Depo-Provera, we mentioned Restra, and Depo-Provera is the birth control salt given once every 3 months to prevent pregnancy. We give it as an injection every 3 months to prevent pregnancy, and the effectiveness for preventing pregnancy is 99.7%. Effectiveness of Depo-Provera is 99.7%. So it has the effectiveness is 99.7%. There are no daily pills to remember. It's one of the advantage. You don't need to remember any daily pills once you take the injection. How does the salt work? How does Depo-Provera work? The same way as the pills. It's still hormonal. The same hormonal drugs. It works the same way as the pills, as we explained in the other module. It stops ovulation. Stop ovulation from taking place. It stops menstrual cycles. Stop the menstrual cycle of the individual, and it thickens cervical mucus. Thickens cervical mucus. Don't forget the way we explained the pills. We said that there will be because of the low estrogen in the pills, that it's going to prevent pituitary gland from releasing luteinizing hormone. So as it is in the pill, so also it is in the Depo-Provera. So it's good because of low levels of estrogen in the pill, that is in the injection. It's going to prevent pituitary gland from releasing luteinizing hormone. And once the pituitary gland, because with no luteinizing hormone, the egg, that is the ovum, cannot grow to maturity and ovulation cannot take place. Not only that, it will make the endometrial layer of the uterus to be thin. So because of that, it's going to prevent fertilization. Not only that, the progestin in the pills, in the hormone, that's in the injection, will thicken the cervical mucosa and blocking passage for sperms into the uterus. Now, another thing that we're going to look at is the side effects of Depo-Provera. Extremely irregular menstrual bleeding and spotting for 3 to 6 months. So one of the side effects is that there's going to be irregular bleeding. That we call it extremely irregular bleeding or irregular menstrual bleeding and spotting for 3 to 6 months. Sometimes it might be bleeding, heavy bleeding. Sometimes it might just be a spot, and it means that it's not going to make the menstrual flow of the individual to be regular. Another thing is no period after 3 to 6 months. There may not be any period, as in the flow may not even come at all between 3 or after 3 to 6 months. There may not be period of menstrual flow after 3 to 6 months. There's going to be weight change, most of the time increasing weight. Then the breast tenderness, mood change. The mood of the individual can change, and the breast tenderness, when you press the breast of the individual might have or feel pain. Yes, we said not every woman has these side effects. And then we go to implants. Implants are placed in the body filled with hormones that prevent pregnancy. Physically inserted in simple 15 minutes outpatient procedure. It's a plastic capsule the size of paper mastic inserted under the skin in the arm. And the effectiveness of implant is 99.95%. So implants are placed under the body filled with hormones that prevent pregnancy. So it's an hormonal insertion. So we put it underneath the skin. It's something that can be inserted just within 15 minutes, and it's an outpatient procedure. And it's a plastic capsule the size of paper matchsticks that is inserted under the skin in the arm. And the effectiveness of implants is 99.95%. So we have non-plants when and that of non-plant 2. Now 6 capsule 5 for 5 years, 2 capsules for 3 years. 6 capsules for 5 years, then 2 capsules for 3 years. 6 capsules for 5 years, then 2 capsules for 3 years. The pill works in several ways to prevent. Look at the pictorial, the picture in this slide. Look at it. It talks about the oral contraceptive, and this has a combined estrogen, progestin, birth control pills, and progestin only pills or implants prevent the pituitary gland's release of hormones that stimulates ovulation. Now, in case of implant, it's also an hormonal drug. Don't forget, we said that, and it means that it works. It works like the pills. It works like the pills, but this is just that if it is 6 capsules, it's going to last for 5 years. Or if it is 2 capsules inserted, it's going to last for 3 years. Whereas the pill works in several ways to prevent pregnancy. The pill suppresses ovulation so that an egg is not released from the ovaries and changes the cervical mucus, causing it to become thicker and making it more difficult for sperms to swim into the womb. The pill also does not allow the lining of the womb to develop enough to receive and nurture a fertilized egg. This method of birth control offers no protection against sexually transmitted disease. So as it is, just as it is in the pills, so also is the long plants. So it's going to make the mucus in the cervical mucus to be thicker. The lining of the lining of the uterus, that is the endometrium layer of the uterus, become thinner, so that will not be able to accept or sustain fertilized ovum, even if there's any, and it's going to reduce, or it's going to prevent ovulation from taking place. That is the work of the hormone. Let's consider non-plant consideration. So we consider long-term birth control. They're extremely effective in pregnancy prevention. So it is extremely effective when it comes to pregnancy prevention, and that is, it's more than 99% effectiveness. Then we need to consider non-plants when we are talking about, or when we want a long-time birth control. Let's look at emergency contraception. Emergency contraception pills can reduce the chance of pregnancy by 75% if taken within 72 hours of unprotected sex. When we say emergency contraception, we are talking about the type of contraception that you use after you have had the sex. And we said that if you use it within 72 hours of unprotected sex, then we expect that it's going to work for at least it's going to have effectiveness of 75%. Emergency contraception must be taken within 72 hours of the act of unprotected intercourse or failure of contraception method. So when you feel that contraception method has failed, for instance, when you are using condom and the condom tear, and the individual the man at release to the woman, so it is expected that you use emergency contraception as soon as latest by 72 hours. So within 72 hours, it must be used. Must receive emergency contraception from a physician. It's not just what you just think of doing yourself. It must be that you are familiar with it. Health professionals, physicians it's supposed to be what they prescribe to you. It's not you just using it because you want to use it. And it has between 75 to 84% effectiveness in reducing pregnancy. So emergency contraception floods the ovaries with high amounts of hormone and prevents ovulation. Alters the environments of the uterus, making it disruptive to the eggs and sperms. 2 sets of pills taken exactly 12 hours apart. So we have barrier method. We are going to talk about the barrier method in our next modules by the grace of God. Let's try as much as possible to go through these PowerPoints and listen to the voice message. And listen to the voice message, and try as much as possible to go through it. I still remain Dr. David Olusegun.